This is Haystack TV, powered by HaystackHealth.com. Finding reliable services can be like finding a needle in a haystack. With HaystackHealth.com, finding the needle just got a lot easier. Now here's the host of Haystack TV, Chris Kane.
Strabismus is a disorder in which the two eyes don't line up in the same direction and don't look at the object at the same time. When this occurs, two different images are sent to the brain and confuses the brain. If strabismus is not treated, the eye that the brain ignores will never see well. Doctors from the Colorado Center for Eye Alignment are specialists in treating strabismus in adults. The Colorado Center for Eye Alignment is a practice of 7 board-certified ophthalmologists who specialize in the treatment of adult strabismus. They are all members of the American Academy of Pediatric Ophthalmology and Strabismus. Today we're talking with Dr. Anna Steele and Dr. Christopher Bardorf, ophthalmologists and co-founders of the Colorado Center for Eye Alignment. Now, we had the pleasure of meeting some of your partners when they've come in before and talked to us about adult strabismus. But for our new viewers, can you explain to them what adult strabismus is?
Sure, Chris. Thank you for having us today.
Oh, you bet.
As you said, strabismus is the medical term for eyes that are not straight. There are several different types of strabismus. When an eye turns inward, it is often referred to as a crossed eye, and the medical term for this is esotropia. When an eye turns outward, it is often referred to as a wandering eye, and the medical term for this is exotropia. When one eye is higher than the other eye, it is called hypertropia. And sometimes an eye may drift at an oblique angle such that it is both horizontally and vertically misaligned at the same time. Today, my partner, Dr. Bardorf, and I are here to discuss hypertropia, or a vertical misalignment of the eyes.
All right, well, let's talk about, too, why it is so important to have proper eye alignment, not only, I suppose, for cosmetic purposes, but also to be able to see correctly.
Exactly. When the eyes are properly aligned, the brain receives input from each eye, and the result is the perception of a three-dimensional image. That's called stereopsis, or 3D vision. When an eye is not aligned properly and the brain is only receiving input from the one eye, a three-dimensional image is not possible, and the world appears flat and in 2 dimensions. In addition, if the brain is not able to suppress or ignore the image from the misaligned eye, then double vision results. And in patients with double vision, simple everyday activities that many people take for granted, reading, driving, playing sports, even making eye contact with someone, become more difficult, if not impossible.
All right, and strabismus is something that you could be born with, I suppose, but also adults can get it later in life. What could cause strabismus in adults later in life?
That's true, Chris. An adult may have strabismus that has persisted since the time he or she was a child, and it may never have been treated successfully during childhood, or it may have recurred after being in a satisfactory state for a period of time. However, adult strabismus may arise under many other circumstances. For example, if there is loss of vision in one eye as a result of an ocular disease such as cataracts, glaucoma, or a retinal abnormality, if there is trauma to the eye or eye socket causing damage to the eye muscles or the nerves that send signals to those muscles, in certain neurologic conditions such as strokes or traumatic brain injuries, which disrupt the signals being sent from the brain to the eyes, and in certain medical conditions such as thyroid disease, in which the eyes and in which the muscles and nerves responsible for eye movement do not function properly.
All right, we actually have a testimonial from one of your patients, actually, that was coming to the office after a follow-up to a surgery that you had performed on her, correcting her problem with hypertropia. So let's take a listen and see what she has to say.
Try to keep coping with seeing double, but I was not able to drive, and it was very difficult to read and all kinds of things. And so I went ahead. I had no question about it. You know, I just went ahead with the surgery, and it all went beautifully. And I can see so wonderfully, and I don't see double at all anymore. I'd say come here, and I mean that. I mean, I come from West Virginia, and I'm coming back, you know, for whatever checkups I need, because I couldn't have had a better experience.
Now, Dr. Bardorf, misconceptions, there probably are quite a few out there. Is there anything that you'd like to make our viewers aware of?
Yes, the most common misconception is that nothing can be done to treat misaligned eyes. And we see patients every day that have been told their whole lives that nothing can be done to help them. And in fact, the exact opposite is true. We successfully treat strabismus in patients of all ages. Secondly, the treatment for misaligned eyes is not purely cosmetic. Cosmesis may be one of the main reasons that brings a patient in for treatment, but the treatment is both functional and restorative. If we can realign the eyes, we can bring back the proper function of the eyes and the visual system.
Now, Dr. Steele, first Dr. Bardorf addressed the fact that this is not primarily for cosmetic reasons. It really is to help you see better.
Certainly. Many adults with strabismus have been told for years, as Chris said, that the problem is considered cosmetic. And this is simply not true for a variety of reasons. Treating an adult with strabismus can improve depth perception. Double vision may resolve or dramatically improve. And this is the fact, this is true in the majority of cases, even when the strabismus has been present for many years. Many patients, specifically with hypertropia, will use a head tilt in order to normalize their double vision, and once the strabismus has been successfully treated, the head tilt resolves. And finally, many of our patients report enhanced self-esteem, communication skills, job opportunities, as well as an improvement in their ability to read and drive.
Now, it's great to know that there are options for people that have been told in the past that really nothing can be done. So talk about the treatment options that are available for people that do have adult strabismus.
Well, several treatment options are available depending on the patient's symptoms and the type of strabismus that they have. On occasion, no intervention is necessary. There are conditions that either resolve on their own or produce only mild or intermittent symptoms that don't affect the person's daily activities. And in those situations, observation is perfectly reasonable. For those situations where a person's normal activities aren't able to be performed, then treatment is considered. For more milder forms of strabismus, we can treat with glasses or prism glasses to help lessen or even eliminate double vision. There are certain types of strabismus that can be treated with eye exercises to help improve a patient's control over their eyes and help alleviate their symptoms. And for more severe forms with more significant symptoms, we can perform eye muscle surgery where one or more of the eye muscles are weakened or strengthened to help realign the eyes and bring back the proper function of the visual system.
Excellent. Well, thank you both for being here. This is really amazing information, and there is hope for people that have been told that there is nothing that can be done, and it's great to know that you're here and able to help them. So I'm going to tell people how they can get a hold of you, and thank you again.
Thanks.
Thank you.
Adults with strabismus now have a specialized center in Colorado which can offer help. The physicians at the Colorado Center for Eye Alignment look forward to helping you with these problems. You can call them now at 303-463-5795, or you can visit their website at eyealignmentcolorado.com. The number one more time is 303-463-5795. The Colorado Center for Eye Alignment sponsored this segment.